And welcome to Healthcare Sucks Part 2 tonight. We're going to jump right back in where we left off. I just didn't want the tapes to be too long tonight. Um, with that, we're just going to jump back in here and see where this goes, and then I've got some other places to take you.
2020 and praises the Chinese Communist Party as a hero. A netizen wrote that the book is already available for pre-order on e-commerce site Taobao, which is owned by Alibaba. The netizen added he thought the first chapter would start with Li Wenliang being warned by police, but there was no mention of Li Wenliang at all. Li Wenliang is the whistleblower doctor from Wuhan who tried to warn his medical friends about the coronavirus outbreak, but was silenced by authorities. He later died of the virus. This netizen added most people are still alive and know the truth, and yet authorities are already tampering with history. He says he doesn't dare think about the past. And in the U.S., Senator Marco Rubio tweeted on Friday morning, the first coronavirus-related drug shortage in the U.S. is not the last. He said it's by far the single greatest threat our nation faces from the outbreak. On Tuesday, Secretary Azar confirmed to Senator Rubio that this is a wake-up call that perhaps we are overly dependent on a supply chain so heavily concentrated in one place in the world. Yesterday, Senator Rubio released a plan to combat America's supply chain risks and U.S. dependence on China for pharmaceuticals. And the U.S. House of Representatives could vote on an emergency bill aimed at providing funding for the country's coronavirus response as.
And I do got to bring you up to reality check here. I went to the pharmacist today too, and I've known my pharmacist for 20 years, guys. So there's no BS between us. This guy's great. He's been doing it for like 40 years, guys. And he just what you heard, he confirmed that that's the problem is we've been outsourcing for so long, and it is getting hard to get stuff already. And one of the blood thinners I usually get 6 boxes of these things to last a month because I have to give injections. Not much fun, guys. Worse than being a diabetic. And I'm one of those too. Yeah, I'm sick. But not sick in the head. I'm crazy like a fox. That's right, man. I'm crazy like that fox. Remember that old fox guy that did. Anyway, enough flashback. Um, that was kind of funny though. You gotta admit. I lost my train of thought. It was so funny, guys. Anyway, back to seriousness about the. So I still got it. So anyway, one box instead of 6, and then there's no more to order, guys. No more of this medication, and a couple of my other meds I take. He said he's not sure how it's going to be going, and that they're already starting to see that there's only so much out there right now. So this fits right into what we just heard from whether you like Marco Rubio or you like this person or you like that person. He's right. We do need to start making it in the United States. Plus jobs for the U.S., jobs for our people. We need to stop these banks from getting multi and these ultra rich pukes that want to get rich, and to our losses and now to our pain and suffering. Why China took our secrets and took our business, took our jobs. It's time to bring it back home. Like Mr. T's been saying all along. There's some reality to this about bringing everything back. USA needs to be sticking to USA. You know, during WW1, WW2 type scenario, we took I believe it was Ford for one, and retooled. Remember what I was talking about, the cities? You can retool to make other things. They retooled to start making planes and all kinds of stuff. And if you remember right, the girls went out and helped in the production lines because the guys were gone. I mean, that is some American ingenuity and Americanism to where that's what makes America strong, guys, is pulling together. That's why I come to you again with the old 99%. It's what makes America great, if you want to use that phrase, is that we're all that. Unless you're a 1%er, I don't know anybody. And those people got plenty. They ain't worried about us. As you've heard, Agenda 21, we're expendable. Look at Event 201 before this came out. Was this preordained or pre-planned? One world order. Yeah, these are big things I'm throwing at you. You're welcome to research them. These are things that are realities, though, now. It's not fair porn. It's not fiction. It's reality. With that, I'm using the Fair Use Act. And everything you see here, as always on this channel, it's all fake, right? It's all fiction. It's like a fiction book by Stephen King. Or is it? I think we all know the truth to that, don't we? So let's jump back in.
Soon as next week. That's according to a congressional source who added negotiators are looking at approving between $6 to $8 billion in funding for the response, which is exponentially higher than the $2.5 billion the White House has requested. The public's access to truthful information is essential during contagious disease outbreaks. The Taiwanese government has detected large amounts of fear-mongering rumors circulating online, and they say many have links to mainland China.
While battling to control the coronavirus outbreak, Taiwan is now facing another war, no easier, combating online rumors about the virus. The self-governing democratic island has detected misinformation spreading on social media. The posts often appear to be from relatives of Taiwanese officials. Some of the posts show screenshots of horror films with claims that many people have died in Taiwan and the Taiwanese government is covering up the outbreak. However, some of the posts include simplified Chinese characters, which are used in mainland China. Taiwan, however, uses traditional characters. The posts also use phrases common to mainland Chinese dialects, but which are never used in Taiwan.
So if you tuned into part 1 of this, I threw out that scenario that this is basically not accidental. This was on purpose. Here's more of leading down that road. They're trying to propagandize, and they do it all the time. But whether you know or not, Chinese and Taiwan have been fighting. They want to annex them back in and control all that. That's the part of the islands and the lands out there between Japan and Taiwanese and China that they're building those fake islands on and taking over. Well, they want to annex and take them back and rule them and all this. So, but that, it's your guess. It's you're smart as I am. You guys can put the pieces together and let me know what you think. I'm just going to keep throwing it at you and see what sticks or what we figure out. But I can tell you damn straight, they've been covering it up in the United States, and it is tied in to the stock market now, I believe. 100% is why they tapped it down. In addition to that, we came out, if you looked at things running last night, WHO and One World Bank are tied together in regards to there's these stocks. They're like coronavirus stocks. Basically, they were stocks that the Wall Street and all the places were bidding on, that nobody will get sick between this time frame and that time frame. And in June or July, those stocks pay, I can't even tell you how much, billions of dollars. I'm pretty sure it's billions of dollars, probably multi-billions of payout if this thing is not addressed or called a pandemic. That's why one of the two reasons that the WHO is not calling it a pandemic. Second reason is they've got these funds they sit on. Once they call it a pandemic, they have to release them. Those guys are bad guys too, like China. Double bad guys. And One World Bank, that's one of the most evilest things out there, guys. I'm not kidding you. Check into it. Here we go.
Taiwan.
From our initial investigation, the IPs are from overseas. From the phrasing of the
A city council member stepping out to clarify rumors after a recent post on China's messaging app, WeChat, claimed a person in Flushing, New York is infected. The post circulated widely among New York's Chinese communities, prompting a sales plunge for local businesses. Lately, rumors of the coronavirus have been spreading on WeChat, an app popular both inside China and among Chinese immigrants overseas. As concern over the outbreak grows, businesses inside Chinatowns in cities like New York, Boston, and Vancouver are suffering. Some restaurant owners say most of the customers they've lost are Chinese. Some of the posts are purely rumors, but some feature alarming headlines. Recently, a public WeChat account targeting an audience of Chinese immigrants and visitors in New York published an article titled, "The U.S. Admits the Virus Outbreak Will Explode. Whistleblower Says CDC is Intentionally Covering Up, and there are over 1,000 cases in the U.S." The article...
What do you believe? I definitely believe, whether that's true or not, that could be propaganda. We know that they're tamping it down so the stock market doesn't crash any further. And it's going to, guys, no matter what. But there are more and more cases. The deeper in the private contacts I'm making right now, and the people talking to me off the record, they're seeing these. They've already seen these cases coming and going. California only had 200 test kits a few days ago, and those are the same test kits, by the way, that are like 50 to 75% wrong. So the first time you take it, no. Second time you take it, no. The third time, maybe you're full blown by then and it comes up positive. Then you've already heard previously on the part 1 of this, you can be reinfected. Yes, watch part 1 if you haven't. You can be reinfected, which the little squiggly guy on the Trump team now from the health bunch, yeah, kind of not funny. That little squiggly guy from allergy control and whatever. Oh, you cannot be reinfected, and it's going to be all just okay here, nothing to see. Go about your jobs, work hard. You know, that's what's causing the fear is these guys, and then bam, it's out there. I put to you that out of the 50 states, I'd put a fourth of them already technically probably have it running around, whether it's been called or not. And that's not fear mongering, guys. That's what you go out there and you start researching it, and even with the gag order, which you already know once they put a gag order out, they're covering something up. They are.
has been viewed over 100,000 times on WeChat. The account boasts over that he and his colleagues too are afraid of death and infection.
Some of our team members dare not tell their family members. Do you know the first thing that some people did after they were notified of the dispatch? They took a photo with their family members, fearing they will never return.
Medics sent to Ejo are fairly young, as the workload is intense. A 6-hour shift in a hazmat suit means lack of oxygen, lots of sweat, and no bathroom. Patients who are critically ill have little chance of survival, Chen said.
We took over about a dozen patients who were critically ill, and 6 of them have passed.
Chen told us patient situations can quickly turn bad. He said he had...
So that's... What numbers are that? 50%, guys. You're not hearing that on no TV. You're not hearing that from Mr. T's team or the WHO. He said a dozen people, 6 died. That's 50%.
The patient with kidney failure and a lung that was hardened like a stone within 3 weeks of having symptoms. He hopes the outbreak will soon end. Xiaohua Gu, NTD News, New York.
Chen told us despite having support from over 700 doctors from other provinces, the local city is still struggling to cope with the amount of patients it is now facing. Shortage of medical supplies is also a problem. Izhou used to rely on Wuhan for medical supplies, and now the city has to secure their own after the lockdown. A Chinese scientist was sentenced to 24 months in federal prison for stealing more than $1 billion in trade secrets from his former employer, a U.S. petroleum company.
Tan Hongjing, a Chinese national and U.S. permanent resident, was arrested in December 2018. He pleaded guilty last November to charges relating to stealing trade secrets after admitting to downloading research materials from Phillips 66 without authorization. The stolen information related to the manufacturing of an unspecified energy product estimated to be worth roughly $1.4 billion.
Back on the Wuhan track. Here we go.
Here in the United States, a man in his 50s dying from COVID-19 infection in Washington state. Authorities describe him as an at-risk patient, but say he had no apparent travel to China. It is one of several new cases there. The governor declaring a state of emergency. President Trump and his team confirming the fatality at a news conference this afternoon and warning Americans not to panic, while also announcing new travel restrictions and advisories, including in parts of Italy and South Korea. The president also defending his administration's response, but less than an hour later before a conservative audience accusing Democrats of trying to weaponize the virus politically. But the number of coronavirus cases at home and abroad continue to climb. The financial markets rocked, and more aggressive steps to fight the spread are just now beginning. ABC's Adrian Bankert leads our coverage from the hospital where that patient died in Kirkland, Washington.
Tonight, the governor of Washington declaring a state of emergency after the first known coronavirus death in the U.S.
We are having increasing cases in the United States, and we expect to see increasing cases locally.
The CDC says a man in his 50s with underlying health conditions has died, and he had no known travel to China. The state also confirms an outbreak at a long-term care facility, 2 people associated with the facility testing positive, and more than 50 patients and staff now being tested.
We're in the process of investigating this situation as an outbreak.
One of those cases is a woman in her 70s in serious condition. President Trump gave a late afternoon press conference before the CDC confirmed the death.
Unfortunately, one person passed away overnight, medically high-risk patient.
The president and his team attempting to calm the nation's fears.
There's no reason to panic.
Tapping it down, tap it down, tap, tap, tap,
This is something
tap.
that is being handled professionally. The country as a whole,
Here we are.
because we get asked that all the time, still remains at low risk. But when we say that, we want to underscore that this is an evolving situation.
This brings the total number of Americans diagnosed with COVID-19 to at least 69. The CDC investigating at least 8 cases of unknown origin, which means the patients did not travel outside the country, nor did they have contact with symptomatic individuals. At least 3 states, Washington, Oregon, and California, are now seeing cases of community spread. A high school student in Washington among those cases, and possibly the youngest, now in quarantine. The student developed symptoms last week, but returned to school after feeling better, unknowingly putting dozens, if not hundreds more at risk.
We elected to close it in an abundance of caution and care for the children and adults in our schools and community.
And in Oregon, an elementary school employee showing symptoms in Clackamas County who may have exposed students and staff. Authorities disinfecting campuses, warning parents to be on alert.
All right, Adrian Banker joins us now from that hospital in Kirkland, Washington. This is in the Seattle area.
So you just heard some really interesting things. First, the Tap It Down squad with the little squiggly guy. You know, Mr. T's biting the bullet on this. This is all about the stock market, guys. I just wish he'd come out and tell us the truth. Step across the line on this, because he's going to need to. That's why he made Pence the fall guy. Pence going to bite the bullet on this, man. It's going to come back to haunt him. You watch. You heard it here first. It's going to come back to haunt Pence. You watch. So we've got 8 of those weird cases that didn't come, don't know where it came from, whatever. Now they've got it. We've got almost 70 cases that they're admitting to in the United States. And I put to you a hell of a lot more. And I heard the other night that they're basically, because they're out of the test kits, if people are going to the doctors, and this is up to whether you got a good old school doctor that knows what the hell he's doing, or you've got some little nurse quack practitioner nurse practitioner that they put because we're short of really good doctors because they all started retiring because of the BS from healthcare sucks from the Obama era, from us giving away too much power to the insurance companies. Do you know a doctor pushes so much paperwork anymore? And I think they did it intentionally to keep doctors from having the time to be doctors. In the next era, guy, of whatever healthcare by whatever party, I urge you to let's put the power back in the doctor's hand. He signs, he writes, the government pays for it. And this thing, I'm go real quickly. I've done healthcare. I've watched insurance things come and go in other states, in particular in the state of Oregon. I've watched ideas with insurance things crash. Some of them within 60 days. Literally. When they were writing our insurance stuff, there was a lot of hokey pokey going on between Governor Kitzhaber. He had a girlfriend on the side. They were doing Martha Stewart things with the market. And they gave a bunch of money to Samaritan. People made monies. No kidding. And then before Little Miss Know-It-All Kate, Governor Brown, got in here officially, she was on another committee that they crashed the computers and spent $3 million or $30 million on some stuff, somewhere between that and that. I know that's a big widespread, so let's just say 10 million plus on computers and programs and going to get the health system all going in Oregon. All of it got wasted away. Then they were going to buy the Kentucky healthcare plan. Stupid, stupid, and stupid. Now, maybe you guys don't understand Medicaid, Medicare for all, but I'm going to explain the way Medicaid, Medicare all for should work. And I know what I'm talking about. To do it correctly, it's going to save money, not cost money. What you do is, number one, you eliminate all these brokers, like, let's call them middlemen. We don't need the middlemen. We eliminate all that. The secondary thing you eliminate is one plan for the whole United States. One set of covered medications. In Oregon, we have so many of these middlemen running around and entities making monies off of the monies and in between monies. That's where the millions are turning into billions of wasted monies, guys. Then there's Medicaid, Medicare fraud out there, huge amounts, to where as soon as they find out you've got Medicare or Medicaid, they charge you 2 to 5 to 10 times the amount if you walked in there with cash. That's crooked. That needs to be put an end to. We can get our own setups here to make the meds, or work with Canada if that's what he wants to do. We have to look at other sources now. China's down and out. Period. From here, they're done. We move on. And if we cover all American citizens, people who have come here who are American citizens, I'm not for this giving medical, Medicaid, medical everything to everybody that jumps across that border illegally. I'm not racist. If you come across and you have sick people, yes, take care of them, and then that's it. Another thing is, if you're going to come over here illegally, I'm going to make it very clear, then we start a debt card, which basically for the first 5 years when you start working, you pay back anything and everything that you take in that first 5 years. That's not criminal, guys. That's fair. That's fair for America. America can't give everything away, or there's not going to be anything left, guys. And so the bottom line with that Medicare, Medicaid thing for all is one plan, one set of rules, no middlemen, and we could do it and save money. I can do it. So I challenge any government official out there that thinks it can't be done and be done cheaper than what we're doing now, get a hold of me. I've ran the numbers. I've worked. I was on boards with the governor's situation on medicals and medicine. we would send stuff to these guys and they'd wad it up and throw it in the can. I was on the inter-community team over here at the coast, and they did the same thing. We proposed ways to save money. They didn't want to hear. The governor sent people over to listen to us. They didn't want to hear. This can be done. And so I think you guys kind of know what's going on out there. We'll watch a few more minutes of this, and then I'm going to let you go. But there's a lot going on, guys. And some serious things. There's serious change. And during the last presidency, we heard about change this, change that. The change is good when it's positive change. I put forth to you, positive change is what we need. Not negative change, and not rolling monies back in fat people that work for stock market pockets. You know, no more of the fat cat stuff. We're done. Cut the fat cats off. We need to start taking care of us. Not the 1%, but the 99%, my friends. I hope this wasn't too political tonight, because really there's no political involved in anything I've been saying. I just want us to all have coverage. I just want you to survive the lies they're putting out on this pandemic. And it is a pandemic, guys. In 30 days, we're going to be seriously knowing where this is all at. I'm not kidding. Well, did our video actually stop? Excuse me. I have to start it up again, guys. Okay. Why? I don't know why it did that. We're going to jump up.
The patient has died of coronavirus. Adrian, your reporting highlights the developing situation in that state. The governor has declared a state of emergency. Is the federal government sending in additional resources?
Yes, Tom, the CDC is going to be sending staffers here to Washington state to assist both state and local officials dealing with this outbreak. Now, we want to remind our viewers, health officials stress that 80% of coronavirus cases are deemed mild, and that those with existing underlying health conditions, especially respiratory problems, are most at risk. Tom?
All right, Adrian, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC.
Evacuees at 2 California bases did not have proper training or gear.
How they got back home. They were from all over the country. Where did they stay? I heard that one of them stayed at least in a local hotel.
Tonight at Travis Air Force Base, there are still 150 passengers from the Diamond Princess under quarantine. 44 American passengers have been sickened. We followed Mark Jorgensen when he flew to Travis 2 weeks ago on a plane with infected passengers. Jorgensen had to leave his wife, who had the virus, behind in a Japanese hospital. Tonight, he's off the base and in a hospital after testing positive for the virus.
It says get all your stuff and throw it in biohazard bags. So that is all my luggage that is going to be thrown on an ambulance with me.
All right, so let's get back to Will Carr. He's with us live from California again tonight. And Will, I know with this second case now confirmed of possible community spread, health officials are now telling you they're concerned that the virus is being spread by people without symptoms.
That's a major concern, David. You've seen people coming into the United States at airports being tested for having a fever. Well, the big concern here is all the people who don't show any symptoms who could still pass along the coronavirus to other people. One public health official here tells me tonight that we have no idea how many Americans actually have the virus. David.
All right, Will Carr leading us off. Will, thank you. Wall Street plunging again today.
Did you hear
with
that?
A slight rally in the final minutes, closing out the worst week since the financial crisis in 2008. The Dow down 357 points after falling nearly 1,100 points earlier in the day. Big losses every day this week, a loss of more than 12%, in fact. That hasn't happened since 2008. Let's get right to ABC's chief business correspondent, Rebecca Jarvis, live at the New York Stock Exchange again tonight. And Rebecca, there was a rare move from the Fed chief today, offering words to try to calm fears, to try to calm these markets.
That's right, Dave.
Here's some good stuff. Check this out.
Joe is one of the drivers that have been transporting patients since the coronavirus outbreak began.
And now I'm going to follow Joe to see how he transports the patients.
我们运送的是轻重病人、密切接触者跟疑似患者。我在这边等一下了。
Today, he is taking some patients that were discovered in the second round of comprehensive checks. Peng is one of them.
我再不管我是阴性放阴，要说把我东西让我立死的。
你不想吃是吗？
肯定不想去的。
Does he seem happy?
With Joe's help, all the other patients were checked in, but Peng was very reluctant.
你要是告诉我了，你想不想？我现在不能说几号嘞？他今天给你检查，我就拿说个实话，如果真的有个床，那个居是极好的事。对呀。有些人能想就结果了。
他说他有这个双阴病。
那我就不知道了，就是说你作为屋的人家的通知人。
对。那通知错了是吗？
不。
那肯定是有，肯定片子上有问题。
他认为自己没问题。
It talks about the guy said that he'd already been tested twice and it came back negative and he didn't have no effects and etc. And he's very unhappy. He's very unhappy because that's what they're doing. They're throwing people in the pocket. These are the lucky ones. The ones that we've been seeing them getting beaten and thrown in things. And they're not going to this facility. You know where they're going, guys. To some camps somewhere. If they're lucky. Could be much worse. So with that, we've chatted. We brought you some news tonight, a part 1 and a part 2. I hope there's things out there that will help you and your family and your friends and your neighbors. If you don't like what I talked about on the healthcare system, let me know what your ideas are. I'm putting together another plan right now. But left or right, no matter who wins, not to get political with this thing, but let's just say in 2020, no matter which side, healthcare is going to have to be addressed. That is, if the WUHAN 19 doesn't take us away because I got the spots going, and the spots tell the truth. That it's in America. So remember, healthcare sucks. All right. Good job. And that was the Wuhanicorn back to tell you that yes, it's in America. And may you have a good night. And healthcare sucks. Over and out, my friends.